There are 7 tarsal bones forming the posterior segment of the foot, and together they serve as the foundation for how our entire body weight is distributed through the lower limb and into the ground. These bones aren't just sitting in a stack, they create a dynamic, supportive, longitudinal arch that channels weight from the tibia, through the ankle, across the midfoot, and finally toward the balls of the feet and the toes. This arch then redirects that force back toward the heel, helping us stand, walk, and run with efficiency and balance. If we look at the foot from a medial perspective, one bone stands out as the literal high point of this arch, the talus. Think of the talus as the keystone of a bridge. It supports the arch above and below, transferring weight from the tibia into the rest of the foot. Because of this strategic position, the first tarsal bone worth exploring is the talus itself. The talus sits at the very top of the tarsal group and is unique because it is the only tarsal bone that directly articulates with the leg bones, the tibia and fibula. Its superior surface has a smooth, block-like shape that fits neatly between the extensions of those bones. The tibia reinforces the ankle medially with its medial malleolus, while the fibula supports the joint laterally with the lateral malleolus. Together, they form the true ankle joint, allowing the up and down movements we call dorsiflexion and plantar flexion. But the foot is capable of more than simply pointing and flexing. Rotational movements of the foot, specifically inversion and eversion, take place at a different articulation called the subtalar joint. This joint forms where the talus meets the bone beneath it, allowing the foot to tilt inward or outward as we adapt to uneven terrain or adjust our balance. Anterior to the talus sits the next tarsal bone, the navicular. Its name comes from the Latin word for ship, and appropriately, it has a smooth, boat-like shape. The navicular sits on the medial side of the foot and forms a key bridge between the talus and the next row of tarsal bones. Weight passing forward through the foot transitions from the talus into the navicular before continuing toward the toes. Inferior to the talus lies the largest tarsal bone, the calcaneus, the heel bone. This is the bone that strikes the ground when we take a step, and it absorbs massive forces with each stride. The calcaneal tendon, also known as the Achilles tendon, attaches to its posterior surface, anchoring powerful calf muscles that enable us to push off the ground when walking or running. Depending on how weight is being transmitted, force can pass downward through the talus into the calcaneus or forward into the navicular bone. Moving further along the medial side of the foot, the navicular articulates with 3 additional tarsal bones positioned anteriorly. These are the cuneiforms, medial, intermediate, and lateral. Their names describe their relative positions based on the body's midline rather than their position in the foot. Even though the lateral cuneiform is not the outermost bone of the foot, it is the most lateral of this specific group of 3. Each cuneiform connects to a corresponding metatarsal. While there is some overlap among their joint surfaces, the arrangement is generally a straightforward one-to-one relationship between the 3 cuneiforms and the first 3 metatarsals, forming the base for the first 3 toes. The final tarsal bone is the cuboid, located on the lateral side of the foot. This bone has a more square-shaped appearance and articulates with the 4th and 5th metatarsals. Posteriorly, the cuboid also meets the calcaneus, helping complete the lateral column of the foot. Together with the cuneiforms and navicular on the medial side, the cuboid ensures that weight is evenly transmitted through both the medial and lateral arches as the foot adapts during movement. Each of the 7 tarsal bones has a distinct shape, position, and role in stabilizing the foot and dispersing weight.